About 15% of children in the United States receive special education services. Millions of these students with disabilities also get federal funding to attend public school. But with cuts to education funding at both the state and federal level, our Aubrey Wright reports that special education advocates are not optimistic about the future.
The Individuals with Disability Education Act was created to support students with disabilities, and that act provides federal funding and enshrines their right to appropriate education. But as the Trump administration pledges cuts to the U.S. Department of Education, schools with tight budgets may struggle to meet legal requirements.
Christy Brown Loftland says the Autism Society of Indiana wants to make it easier on families.
You know, it's already confusing for a lot of parents when they first get the diagnosis of autism.
About 1 in 36 U.S. children has autism spectrum disorder. After diagnosis, Brown Loftland says some parents may have no idea what to do next.
Oftentimes the public doesn't understand necessarily about what kind of services are offered to a child with a disability.
The federal government established protections and funding for these students with disabilities through the IDEA. But some believe the act and the rights it guarantees are threatened as the Trump administration reshapes education.
It's going to affect millions of students with disabilities and their families. And I think that's very concerning.
It's been 50 years since Congress passed the IDEA and changed special education in the U.S. It's difficult to imagine education before it was enacted.
Something that we're able to kind of take for granted, and that is students with disabilities included in typical classrooms with everybody else as much as possible. That's not how it always was.
The act states students with disabilities must have access to free and appropriate public education. Nord says through the act, young children have a right to early intervention that identifies their disability before starting school. And when they reach the classroom, they have special services to accommodate their disabilities and help them learn. He says these critical services are important for students and for their futures.
Education is a process, and at the end of that process, we're hoping to have citizens that can contribute to society and understand and be independent and be able to be a community member.
Many students with disabilities have individualized education plans, and Brown Loftland says there's been a big push for inclusion.
If possible, we would like for that student who does have autism to be in a classroom with his non-disabled peers and to be presented the same curriculum.
Nord says the federal government partially funds this required support for students with disabilities, equaling about 13% of special education funds. And he says there's a lot of fear about what comes next if it's lost.
Because federal law states that we can't go back, that students deserve to be there, and not just deserve, but it is their right to be there. So balancing this out, how do we make that happen with fewer resources is a real concern.
Like Nord, special education advocates say Indiana's public schools can't afford any more cuts.
How are special education administrators, teachers, or staff dealing with these shortages already?
Yeah, it is tough.
Quiz says he's seen how schools are already struggling with teacher shortages.
We all want to do everything we can for all of our students, but if there simply are not people to do this work, there are going to be things that don't get done.
He says the federal government actually promised to fund about 40% of mandated services through the IDEA, more than double the current funding rate.
We already start out in a funding deficit model, and if we're going to take more funding away from that, I think we all can do the simple math on that reality.
Quiz says special education budgets are already lean, and public schools will probably not get any more money. It's going to be harder for them to deliver crucial services and to meet minutes required for IEPs. But it will get done. They're making things work. For now.
I have 3 kids. My youngest has an IEP. Fortunately, I work in this area. I've been doing this for 20 years, so I know the ins and outs. So I see what's coming down the tracks.
The Trump administration proposed moving special education programs to the Department of Health and Human Services, which recently fired thousands of workers. For Indiana News Desk, I'm Aubrey Wright.